Hi, I am Dr. Priya Bansal, a board certified plastic and cosmetic surgeon practicing in Delhi and Gurgaon. If you are new to my channel, welcome. I create videos that simplify plastic surgeries to help you make the right choice. 360-degree liposuction. It is also known as circumferential liposuction. This is a cosmetic procedure which removes excess fat deposits in the midsection of your body. Now, sometimes there are stubborn fat pockets in your body that no amount of diet or exercise can get rid of.
I played it innocent, a feel of discontent. I'm finally facing it all, fearless.
A 360-degree liposuction targets this excess fat in the abdomen, the waistline, the hips, the love handles and the back with the help of advanced devices like power-assisted, ultrasound-assisted and radio frequency-assisted liposuction. So usually after a 360-degree liposuction, you are discharged in the next day after the surgery, during which we observe for signs of dehydration or fluid accumulation or any other complications which can happen after a surgery. For the initial few days, you will feel some discomfort in your body, some soreness in your body, for which we will prescribe you enough painkillers, sufficient painkillers to take care of the pain. In a week's time, swelling and inflammation starts decreasing and your body starts recovering and you can resume your desk job. For 4 to 6 weeks after the surgery, you are supposed to wear a compression garment consistently 24 hours a day to help reduce all the swelling which happens after the surgery and to maintain the shape which has been provided during the surgery. Now, after liposuction, many patients ask whether we can resume workout. Yes, you can resume the workout for after around 10 to 14 days of your surgery. Coming to the results, it usually takes around 4 to 6 months for the results to show incomplete. So 360-degree liposuction, it is usually performed under general anesthesia. Once the surgery is over, you wake up but you're still a little drowsy. After the surgery, you should follow the surgeon's post-op care instructions for a quick and painless recovery. Now, here are some tips for post-op guidance. Start walking as soon as you feel ready. We make the patients walk on the evening of surgery itself. This reduces swelling and it also reduces the chances of thrombosis and hematoma formation. Thrombosis is the clotting of blood within the blood vessels, whereas hematoma is the formation of pooling of blood outside the blood vessels in the empty space which is created between the skin and the muscles when we are doing liposuction. Arrange for someone to drive you back home. You will be in some discomfort and some drowsiness because of the medications. You should take off from work for a few days, at least 2 to 3 days, and arrange for someone to help you out at home to get as much rest as required. Now, have a balanced diet with fresh fruits, good amount of protein in your diet and rich in iron to get the recovery going smooth. To have a smooth and pain-free recovery, follow the pain medication schedule strictly as prescribed by your surgeon. Do not consume any other medication other than those prescribed by your surgeon during this period without consulting your doctor to avoid any conflicting drug allergies. Refrain from using alcohol and from smoking as they may lead to potential side effects like fluid retention, delayed wound healing and wound healing complications. Maintain hygiene, take regular shower and keep the areas of surgery clean as advised by your surgeon. Now, while there is a lot of information about who should undergo or who can undergo a 360-degree liposuction, there is very little awareness of what to expect from the surgery. So let me share it with you today. Now, immediately after surgery, your incision sites, they will be covered with a small dressing. There will be temporary soreness, numbness, swelling, bruising, and inflammation in the areas which have been suctioned. Now, most of the bruising they recover in 3 weeks' time. The swelling it goes down slowly. In around 6 weeks' time, most of the swelling, around 60 to 70% of the swelling is gone. But your swelling keeps improving and decreasing till 6 months of time. Now, sometimes a drainage tube may be inserted after 360-degree liposuction through the same incision sites. This drain is usually removed before discharge, but sometimes you may go home with these drain tubes with the post-op care and advice given by your surgeon. It is okay to feel slightly anxious and overwhelmed during the recovery period. Discussing your insecurities openly with your surgeon will help. As your wounds heal and your scars decrease and fade over time, you will start feeling like yourself and enjoy the perfectly contoured body, which is a result of 360-degree liposuction. Now, the sutures are usually removed between 5 to 7 days after the surgery. The follow-ups are scheduled 2 days after surgery and then a week after surgery. Consult with your doctor immediately if you have any of the side effects like too much of swelling or there is too much of nausea, if there's a fever, you have a lot of drainage more than expected, you should go back to your surgeon and discuss it with them. A 360-degree liposuction can boost your confidence level with a sexy body contour. If you are willing to be patient, you will enjoy the best results of the procedure. To know more about 360-degree liposuction, subscribe to my channel. Also, check out my latest blog on 360-degree liposuction, linked in the description below. So it's time for me now to sign off. Here's to changing lives by perfecting body aesthetics one surgery at a time.